Why the prevalence of depression is increasing in the world? That plant-based diet can be so powerful, it can actually reverse depression. Those who are happier appear to live longer.
Next, I'm going to invite Dr. Paawan Waadhawan. He's going to speak on role of plant-based diet in anxiety depressive disorders.
Hello friends. So this time I thought of presenting something new, that plant-based diet can be so powerful, it can actually reverse depression. In 1946, WHO defined health as a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. So which means if you don't have diabetes, it may not be that you are healthy. You don't have any lung disease, you don't have hypertension, you don't have heart disease. It does not mean you are healthy. So why this mental thing was kept into the definition? Because they did studies and researchers found that positive psychological well-being has a favorable effect on survival in both healthy and diseased population. Those who are happier appear to live longer. Researchers, what they did, they randomized people with good mood and with depression and made them to sniff the common cold virus. They gave common cold aerosols and was sniffed into the people who were depressed and who were in good mood. So people who had negative emotions, means they were depressed, 1 out of 3 fell ill to common cold, compared to the happy people, only 1 in 5 became sick. So this is why mental was kept into the definition of WHO. So this is the data from the Institute for Health Metrics and Evaluation and shows that various kinds of mood disorders prevalent in the world, out of which anxiety and depression are the most common. Now, anxiety and depression are now combined together. Nearly half of those with major depression also suffer from severe and persistent anxiety. People who are depressed often feel anxious and worried. That's why now the term anxiety and depression have been clumped together as MAD, Mixed Anxiety Depressive Disorder. It is not it is a one entity now, MAD. So depression is synonymous as MAD. WHO 2023, around 280 million people are depressed, out of which the most depressed countries is Greenland, and then Greece, Spain, Portugal, Palestine, Tunisia. And you can see here, depression is more common now in younger children. Younger population is more depressed compared to older people. This is WHO 2023. And as Times of India report, in Southeast Asia, India is the number 1 hit by depression. Total cases of depression 5.7 crores, which is 4.5% prevalence, and 3.8 crores cases of anxiety, 3% prevalence. Together we get around 7 out of 100, 7 are either anxious or depressed. Depression is a leading cause of morbidity worldwide, and morbidity is years of healthy life lost as a result of disability, and after ischemic heart disease, unipolar depression is the second most common cause of disability. Why the prevalence of depression is increasing in the world? This is a question which we need to find out the answer. Actually, depression is an evolutionary strategy for defense against infection or inflammation. Infection has been the leading cause of mortality throughout the human history. It has been estimated that prior to the industrial period, the average life expectancy was 25 only, and it was not uncommon for half of the siblings in the family to die before reaching adulthood. With such stark capabilities, infection has been a critical and potent driving force in natural selection. What happens when you are ill with virus, when you have got some kind of infection, once you are recovering from that infection or during that infection, you become depressed. You feel lousy, you want to sleep more, your appetite goes off, you don't want to meet people, you want to take rest. So, is depression a consequence of inflammatory condition? Which means maybe we are inflaming ourselves with some kind of food, because we eat food 3 to 4 times daily and we are inflaming our bodies. So body is fighting infection since decades, and it thinks that you are inflamed and that behavior of getting sick, because it is a natural selection that body don't wants to spread inflammation or infection. So it makes us more depressed. But this is a theory, and let's look into the review of available evidence. Most of the evidence that links inflammation and major depressive disorders comes from three observations. Major depressive disorders is always associated with raised CRP. If you are seeing in your OPDs, a person of diagnosed with major depressive disorder will always have CRP around 8, 9 or 10. In most of my cases, I see CRP raised. Inflammatory medical conditions, medical illnesses which are both CNS or peripheral, are associated with greater rates of major depression, which may be multiple sclerosis, it may be any kind of myasthenia or any kind of rheumatoid arthritis. But researchers thought that if somebody is suffering from multiple sclerosis or rheumatoid arthritis, he may feel terrible that I am having a disease, so I am depressed. But it is not so. They dig into it, and this observation of increased mood disorders in more benign inflammatory conditions, like a person who has mild asthma, some kind of, he is sick but mildly sick, some mild psoriasis, some mild eczema, they are also same depressed as a person who is depressed with a terrible disease, which means it is not feeling bad about having a terrible disease, but may have a more biological nature to the sickness behavior, the inflammatory mood pathway. And cytokine based immunotherapy used in cancer causes major depression, we all know. Vaccination containing live viruses, once आप injection लेके आए, you will feel for 2 days you are most lousy, more sick, more you don't want to eat food, you don't want to meet people. So all live viruses vaccines cause depression. So these results are strongly suggestive of inflammation being a causative factor for mood symptoms. The relationship between mental health and inflammation was first noted in 1887 by Julius Wagner Jorag of the University of Vienna, Austria, affording him the opportunity to be the only psychiatrist to ever win the Nobel Prize in 1927. So actually, friends, we are constantly inflaming and infecting our bodies with inflammatory diets, and depression is just a natural selection, just an evolution as a defense to limit its spread. That's why depression is increasing. Prevalence of depression is increasing. The basic reason may be something else. This study, inflammatory dietary pattern and risk of depression among women. Conclusion, the inflammatory dietary pattern is associated with the higher depression risk. This finding suggests that chronic inflammation may underlie the association between diet and depression. Then what is anti-inflammatory diet? A diet rich in fruits and vegetables is associated with lower levels of inflammatory markers, perhaps because of the anti-inflammatory properties of antioxidants concentrated in plant foods. Restriction of meat, fish and poultry in omnivores improves mood. A pilot randomized controlled trial, several mood scores for which participants improved significantly after 2 weeks of intervention. Just they stopped meat, fish and poultry for 2 weeks, moods improved. Vegetarian diets are associated with healthy mood states. A cross-sectional study, and you can see in 7 days when all the non-veg was stopped, the tension levels decreased, and depression decreased, anger, hostility decreased, confusion decreased. One more study, they took men and women who ate meat at least once a day and took away their eggs and chicken along with other meats to see what would happen to their moods. Within just 2 weeks, the study subjects experienced significant improvement in measures of the mood states. In general, eating lots of fruits and veggies may present a non-invasive, natural and inexpensive therapeutic means to support a healthy brain. Mechanisms by which WFPB, means whole food plant-based diet, elevates mood in major depression. Accumulating evidence suggests that oxygen-free radicals, those highly unstable molecules that cause tissue damage and contribute to aging, may play an important role in the development of various psychiatric disorders, including depression. Effect of long-term vegetarian diet on biomarkers of antioxidant status and cardiovascular disease risks. Actually, long-term vegetarian diet has a better antioxidant status. So, the researchers concluded that eating antioxidant-rich plant foods may dampen the detrimental effects of oxidative stress on mental health. This is one more theory. We all know our all painkillers work on the concept of blocking the arachidonic acid pathway. So arachidonic acid is a pro-inflammatory compound which is found in animal foods. This pro-inflammatory compound, arachidonic acid found in animal products, can adversely impact mental health via a cascade of neuroinflammation. The body metabolizes arachidonic acid into an array of inflammatory chemicals. In fact, that is how our anti-inflammatory drugs like aspirin and ibuprofen work to relieve pain and swelling by blocking the conversion of arachidonic acid into these inflammatory end products. People with higher levels of arachidonic acid in their blood may end up at significantly higher risk of suicide and episodes of major depression. These are the food, this is the data from National Cancer Institute, the food sources with highest level of arachidonic acid, and it's all chicken mixed dishes, egg mixed dishes, beef, and all fishes, burgers. So top is arachidonic acid is found in animal foods. Other theory, happy hormone serotonin. It is a type of monoamine. It is concentrated in plant-based diets. It can't cross the blood-brain barrier, but it is a precursor. Tryptophan can. So serotonin, you all know, we have two happy hormones in our brain. These are the two neurotransmitters, serotonin and dopamine, out of which serotonin is found in plant-based diet, but it cannot cross the blood-brain barrier. But its precursor, which is tryptophan, can cross blood-brain and make you happy. This was theory pharma people found, and they developed tryptophan supplements were developed in 1980s, but caused a major rash of deaths, and they were withdrawn from the market. We can say tryptophan is an amino acid, and amino acid is more in protein-rich foods. So why not give people high protein meals? Will boost their serotonin levels by delivering extra tryptophan to the brain. They tried it in the study, and it's been tried and it's failed, likely because other amino acids in the protein-rich foods crowd out the tryptophan for access to the brain. Means there was a competition between various amino acids to enter into the brain, so tryptophan was forced out. But surprisingly, carbohydrate ingestion helps shunt many non-tryptophan amino acids out from the bloodstream and into the muscles, allowing tryptophan greater access into the brain. This study long-term effects of a very low carbohydrate diet and a low-fat diet on mood and cognitive function. And result was diets high in carbohydrate and low in fat and protein are associated with lower levels of anxiety and depression and have a beneficial effects on psychological well-being. One more theory. Serotonin and dopamine are there in the brain. They are responsible for good mood, and there is an enzyme called as MAO, monoamine oxidase enzyme, which degrades these two happy hormones. So what happened? Depression is caused by abnormally low levels of serotonin and dopamine due to elevated levels of MAO enzyme in depressed people. This was the theory put. And pharma people mastered this MAO theory, and MAO inhibitors were released into the market like phenelzine, selegiline, meclobemide, and they have their own side effects called as one side effect is cheese effect, in which eating certain foods like cheese, meats, fermented foods can potentially cause fatal brain hemorrhage. But yes, there is no doubt that MAO inhibitors have done good among psychiatry people because they are being used like selegiline and rasagiline, two of the potent MAO-B inhibitors which have changed the treatment of Parkinson's disease. But still, from a perspective of plant-based diet, many plant foods including apples, berries, grapes, onions and green tea contain phytonutrients that appear to naturally inhibit the MAO, as do such spices also like cloves, oregano, cinnamon and nutmeg. This is the study from dietary inhibitors of the monoamine oxidase. So we have plant-based diet also. Now the question people ask, sir, सारी खाते हैं fruit तो, सब्जियां सारी खाते हैं, फिर depression इतना क्यों बढ़ रहा है? Why depression is increasing? Actually, for your diet to have a meaningful psychological impact, though you may need to consume approximately 7 servings of fruits or 8 servings of vegetables each day. You should take small servings of fruits and vegetables multiple times in a day. Small katori of boiled veggies, raw veggies, boiled foods, raw foods. you take it multiple times, that actually reverses depression. Natural remedies for depression. People who drank 2 or more cups of coffee daily appear to have about only half the suicide risk compared to non-coffee drinkers. But which coffee? It is not milk coffee, it is black coffee, because antioxidant chlorogenic acid found in the coffee. It is the antioxidant found in the coffee, it is chlorogenic acid. And if you put milk into the coffee, the casein of the milk actually binds the chlorogenic acid. So this study shows that when milk was added to the coffee, antioxidant activity decreased. As compared to coffee on its own, mixing with only 17 ml of milk significantly reduced antioxidant activity by 62%, and mixing it with 100 ml of milk, which we Indian families usually do, it significantly reduced the antioxidant properties by 95%. So means you are making coffee useless. So this is again one study. They showed that effect of simultaneous consumption of milk and coffee on the chlorogenic acids bioavailability in humans, and you can see that once one milk was added, chlorogenic acid significantly reduced. Now exercise. People were randomized, depressed people were taken, and half of the population was given exercise therapy. They were made to walk 1 hour in the morning, 1 hour in the evening, and half of the population was given sertraline, best medicine known in psychiatry for depression. But to the surprise, sertraline people showed improvement in their moods, but the same powerful effect was found in the exercise group, that is the group of people who were not taking any drugs. Exercise, it seemed, works about as well as medication. Do you know about this hormone, anandamide? How many of you have experienced anandamide? I have experienced it. I have experienced when it releases. This is the hormone which causes runner's high. The people who run actually have experienced this, because until unless you have not experienced, you can't tell. This is actually the best meditation, I think, which anybody can do. You switch off your phone, अपना phone बंद कर दीजिए, go to a deep forest or a park with the full of flowers and greenery, and start walking fast pace, brisk walking, because I have done it, that's why I'm telling you. Around 40th minute, keep walking. Around 40th minute, suddenly what happens, now your pain has gone and you want to jump and you want to run now after 40 minutes. Your power has doubled. This anandamide is the reason. This hormone is released from the pineal gland, and this study have proved that exercise increases the levels of endocannabinoids in the bloodstream, unlike endorphins. Endocannabinoids can move through the blood-brain barrier, where these mood-improving neuromodulators promote term psychoactive effects such as reducing anxiety and feeling of calm. You can go to forest, because forest bathing can significantly reduce cortisol levels on a short term in such a way as to reduce stress. Tomatoes, you all know, they contain lycopene, and this red pigment has got very high antioxidant activity, and eating more tomatoes means eating more vegetables. Low dietary folate intake also is associated with depression. Now you can say lycopene is good, folate is good, so let's start taking supplements. But they did study and found that, well, only food sources of antioxidants appear to be protectively associated with depression. The same can't be said for dietary supplements. So, is a whole food and it contains multiple phytonutrients. There is a chemical mixing which should be taken properly, and that study, this is also a fruit, vegetable, and antioxidant intakes are lower in older adults with depression. And in this study, they found that taking supplements was of no use, and especially people think that omega-3 fatty acid supplementation is good for health. And brain behavior and immunity study, they have shown, and I would like to read these lines for you. This is very important, because in this study, they gave omega-3 supplements to the people and followed them for 3 months, and it did not improve their CRP level. These lines are worth reading. These findings are also consistent with the recently published meta-analysis of 13 randomized double-blind placebo-controlled trials that concluded that long-chain omega-3 supplementation had neither statistically nor clinically significant impacts on the depression symptom severity. Moreover, a recent systematic review indicates that long-chain omega-3 do not change inflammatory biomarkers in healthy subjects. So, no use. And you know this? This is Kesar. Saffron is a wonder drug for depression and stress. The effect of Crocus sativus and its constituents on nervous system. It has got anti-convulsant effect. It has got anti-Alzheimer's effects, antidepressant and anti-schizophrenia effects, anti-Parkinson's effect, decreased neuronal injury and apoptosis, decreased neuroinflammation, augments brain neurotransmitters. This study, Crocus sativus versus fluoxetine. Fluoxetine is one of the best antidepressant medication, and they give half of the people. This is a double-blind randomized pilot trial, and to both fluoxetine group and the Crocus sativus means Kesar group, saffron group, the depression scores went down and their mood improved. Almost same. And you know, there are so many antidepressants in the market. You have tricyclic antidepressant, SSRIs, SNRIs, MAO inhibitors, a newer combination. But all these antidepressants can cause mild to severe sexual dysfunction such as decreased libido, decreased delayed orgasms, anorgasmia, and arousal difficulties. And the doctors who are using this psychiatric medication in their OPD, they all know. Anybody who is taking any kind of psychiatric medication is suffering from sexual side effects, especially anorgasmia. They stop feeling orgasm. And saffron reversed it. Saffron may improve sexual function in men and women with major depression who are experiencing fluoxetine-induced sexual dysfunction. Rather, you give saffron, they feel improvement in their moods and their sexual power actually improves. This is the power of whole food plant-based diet. Thank you, friends.